Retinal vein occlusion, or RVO, is a vascular disorder that affects the blood vessels of the retina. It most commonly affects older adults, and if left untreated, RVO and its potential complications can lead to blurred vision and vision loss. There are several symptoms that might point to RVO and its complications. Usually, patients will notice a decrease of vision in one eye. The loss in vision can be partial or complete. There may be blurring of vision, or vision may seem distorted. Objects may appear different for each eye. Factors that increase the risk of RVO include old age, high blood pressure, smoking, obesity, heart disease such as atherosclerosis, glaucoma, and diabetes. There are two types of blood vessels in the eye, arteries and veins. Arteries bring oxygenated blood into the eye, and veins, on the other hand, take deoxygenated blood out of the eye back to the heart and lungs to obtain fresh oxygen. RVO occurs when there's a blockage of a vein in the retina. This usually happens when there's pressure from a nearby artery or if a blood clot forms in the vein. When a vein is blocked, it cannot drain blood from the retina. This can lead to bleeding and leakage of fluid from the blocked blood vessels. There are two types of RVO. In a central retinal vein occlusion, or CRVO, the main vein which carries blood out of the retina is blocked. In a branch retinal vein occlusion, or BRVO, there is a blockage in one of the smaller branch veins of the retina. A central retinal vein occlusion affects the whole retina, whereas a branch retinal vein occlusion affects only a portion of the retina. RVO can reduce vision in several ways. The most common way that RVO causes vision to be reduced is through macular edema, which is swelling of the macula. The macula is the most sensitive part of the retina, and it's responsible for fine, detailed vision, which allows you to read, drive, see faces, and distinguish colors. Researchers have shown that with macular edema, there are elevated levels of a protein called vascular endothelial growth factor, or VEGF, in the eye. VEGF is one of the signals for the body to create new blood vessels in a process called angiogenesis. However, when present in the eye, VEGF can affect existing blood vessels, making them fragile and leaky. VEGF also stimulates angiogenesis and the growth of new, weak blood vessels in the eye, which can also leak and cause bleeding. This leaking of fluids leads to macular edema, which can negatively affect vision if left untreated. To help with diagnosis and treatment, doctors will order a special scan of the eyes, usually at every visit. This is called an OCT scan. The OCT uses light to take a higher magnification view of the macula, and the scans help the doctor make treatment decisions. The OCT scan is quick, painless, and completely safe. In terms of treatment, there's no way to open or reverse the vein blockage. Some patients, with time, will have a spontaneous improvement in vision. Regardless, treatment is usually required to treat associated problems or complications of RVO, including macular edema and angiogenesis. There are currently 3 treatment options for RVO: steroid eye implants, laser photocoagulation, and anti-VEGF treatment. Steroids, called dexamethasone implants, can reduce swelling in the eyes of people with CRVO, helping to lessen or prevent more damage to the macula. These implants are administered under general anesthetic, usually a small injection into the back of the eye. In laser photocoagulation, leaky blood vessels affecting central vision are sealed using a laser. This slows the leakage of fluid, reducing the amount of fluid in the retina. Laser photocoagulation can be used to treat both types of RVO, but has become less common with the advent of other treatments. Anti-VEGF medicine is a specialized medication for RVO that targets VEGF. It's designed to block the VEGF signals which lead to macular edema and angiogenesis. Injection of anti-VEGF medicine has been shown to restore vision in many patients with RVO. Eye injections are generally very well tolerated, but side effects can include local irritation, bleeding of the surface of the eye, and rarely, infection. Patients with RVO will require many regularly scheduled appointments with possible eye injections to achieve optimal results.